Hello and welcome to the Posture Dojo. I'm your host, Sam Miller. I'm sharing my own journey of healing a 85-degree kyphoscoliosis and collaborating and speaking with experts from various fields that have expertise in different methodologies, different practices that we can all learn from and start combining into our own unique healing journey. Our spines are unique and our journey upwards and onwards is unique. So the more we understand our own bodies and explore with different perspectives from other people, we have more tools in our arsenal to really rebuild a posture. And in today's episode, we have Tom Walters from Rehab Science, focused on rehabilitating the body. And I've been tracking down Tom for a while now because rehabilitation, I think, is a big part of what we're doing with this postural restoration. We're born with our optimized posture, and scoliosis and kyphosis means that the structure, our posture, has been compromised in some way, and the healing journey is really about rehabilitating that optimal posture again. So I'd like to kind of dive into those topics. Tom, let us know, who you are, what's your background, and how did you end up kind of doing what you do?
Yeah, well, thanks for having me, Sam. Yeah, so I'm an orthopedic physical therapist. I've been practicing for 17 years, and prior to that, I grew up as an athlete. I was always an athlete. I was in martial arts and gymnastics, and so just like you were speaking to, I was sort of learning about body awareness, and I didn't realize it at the time so much, but I reflect back on those years and just how formative martial arts and gymnastics were to my overall development and who I am now as a physical therapist. But I was very interested in exercise science, so I studied that in my undergraduate years. I was a trainer and was studying exercise science, and then took that, physical therapy. Much of my interest is in kinesiology, and I taught kinesiology for a lot of years at a college here. And kinesiology is the study of human movement. Physical therapy and rehabilitation really focuses on pathokinesiology, which is the study of abnormal human movement. So I really kind of took that exercise science background and what I knew about exercise, and then in physical therapy school, really learned how to apply movement exercise to people with abnormal human movement or dysfunctional human movement. So yeah, I've been out, practicing for 17 years. It's pretty much all been in orthopedics and sports medicine. So it's all the kind of injuries and pain issues that most humans, happen to us at some point in our lives. Things like back pain and ankle sprains and tennis elbow and plantar fasciitis. So those are the things that I treat, but I really am mostly an educator. I actually don't enjoy practicing physical therapy that much. I still see a few patients here and there, but I really see myself as an educator, and I learned that about myself when I started teaching at the college, and now much of what I do on social media and online is still that. It's just sort of online education, and that's really how I view myself, as someone who's teaching people about pain and injury and movement and really how to best address those issues.
So I see you have programs for, you've got, for every part of the body, you've got different programs to kind of rehabilitate. In these postural deficiencies, we have sometimes a collapse of the structure. Sometimes it's particularly on one side with the scoliosis, we have a particular collapse of the lung, and when we have that imbalance, we start getting all these compensations that when are left untreated, we get all types of dysfunction. And on my kind of path to aligning, it's really been activating the parts of my body that were put to sleep and releasing the tension in the parts that got locked up. Obviously, a very common one is the hips. So having an imbalance higher up in your posture, your hips are bracing more than they need to, sometimes taking the work off of the glutes. In my case, that was definitely the case, and I ended up getting very tight hip flexors, which eventually led to choking me out from the inside out. So my posture correction journey really began seriously when I started releasing the tightness in that area and allowing myself to unfold and unravel, essentially.
Yeah, pain and injury is interesting. It's kind of interesting, actually, when we think about posture in the rehabilitation world. There has been, in some ways, kind of some shifting away from posture and its influence and how much I think we used to put a lot more focus on posture in rehabilitation, and that has started to shift a little bit. And I think, but it's still a really relevant piece. And I think what you're alluding to there are situations where it really can be relevant. I think when somebody's had an injury or they have a new pain issue, you're right. We see people adopt different postures all the time. They compensate. They maybe activate certain muscles more. Maybe some become sort of inhibited. And those are things that when somebody comes to see me, I am always kind of looking at posture. I'm noting it. I'm looking at, does it look like this injury or this pain issue is causing them to shift or change their alignment in some way? And I still, I kind of track that over time. So I will maybe we have certain manual therapy interventions. Maybe we have sort of exercises. I look at how does their posture and the way that they move and hold themselves change as their pain reduces, and their injuries heal. I think what's kind of interesting about posture, some of the areas where we've shifted away from it a little bit are people, there are certain postural things that we develop as kids, like flat feet is a good example. And some of the research on that has found that when you look at postural situations, sort of the alignment of our body that develops through childhood, in some cases those don't seem to be that big of a problem. So something like an overly pronated foot, we used to really kind of make that out to be a bad thing, and we would tell people that, we need to correct this pronated foot, just as one example. And it turned out that when you in a lot of cases, when you develop with something from a young age, your body adapts to it, and it's actually not that big of a deal. Now, there are situations, there are things that develop in adolescence, like scoliosis, like you've been talking about scoliosis. Scoliosis can be a real problem. If you develop a really severe scoliotic curve and it impairs your lung function, that can be a real problem, right? So that's why pediatricians are always checking that. I've got 2 kids, and every time we go, the pediatrician checks their spines. So there's a lot of nuance, I think, in posture. And sometimes if you look at it online, you'll see some camps that say, posture doesn't matter. Just don't even think about it at all. And then you'll see other camps that really are into assessing posture and looking at changing it. And so I think sometimes online the nuance isn't appreciated, and it really does. I think how important posture is totally depends on the person, their history. Have they had a recent injury? What kind of pain do they have going on? What kind of postural things maybe were developing when they were a kid? It requires sort of a nuanced approach.
Yeah, so it's interesting you're saying, the goal is, I guess the goalpost moving away from, targeting this great posture to other things. I'm curious what that is, because I know in my practice it's about, building this all-terrain capability. And if you're capable in all terrains, I think the posture will naturally align to support that capability.
I actually really like that. I like that idea, because I think that's very similar to what I'm doing, the mentality I have in rehabilitation, which is making people more resilient to stress. And I think you're kind of saying something similar, where they can adapt to all different terrains and can be successful in those terrains. And I think what happened early on in PT, when I came out of physical therapy school, that was back in 2007, we approached everything with a very postural, structural, biomechanical model. It was the PSB model. And we would have these ideas of what was sort of good posture and what was bad posture. And what we found is that people who had really good posture by textbook definition, they still had pain. We'd still see people with good posture who had pain, and we'd see people with what looked like really bad posture who didn't have symptoms. So, I think what we've learned is that the nervous system and the pain system within our nervous system is more complex, and it's not always just about posture, structure, and biomechanics. So that's kind of looking at it just from the pain perspective. And I think I'm more interested maybe in what you're talking about there. Can people get into lots of different postures? I'm more interested in kind of movement. Can they, if they're in a particular posture, can they move out of that posture? Do they have that capability? I've moved away a little bit from this is the perfect posture and you have to be here, kind of that static mentality, more just like kind of that martial arts mindset again. Can you move through different postures?
Smoothly.
Exactly.
The, the wobbles and the shakings, you have that core balance, you have that core strength, you have that dynamic movement. Beautiful. I mean, yeah, so we're definitely lining up with that. I'd also, you mentioned the nervous system. I would like to dive into this because there's a really lesser known theory around scoliosis that I really believe needs more attention and more people in the conversation, because I really think it's at the core of the cause. 80% of scoliosis is idiopathic, undiagnosed. But there's a Dr. Roth in 1969 did a study or made a theory. He wrote a paper that his theory was that when the nervous system clenches and the vertebrae continues to grow as you do in your teenage adolescent years, you get this raveling, which looks exactly like scoliosis. And I think it's really important to understand, because as I've started integrating this into my my movements, my different exercises that I do, as I'm calming the nervous system instead of focusing on force and muscle, I'm really focused on, I guess as you were saying, being calm under this physical stress of the movement that I'm going through. Relaxing the nervous system as I'm going through the movement is allowing so much more expansion and alignment to happen in the body, and I feel it. So, what would you say to that? Like, what's your perspective on that?
Yeah, I think that theory is really interesting, and I've read about that as well. I do think that it's entirely possible that many of these idiopathic cases have some sort of origin in the nervous system, where there is this kind of neural tension type concept where, because if your nervous system, we look at neural tension and neuromobilizations for lots of different conditions now, sciatica, carpal tunnel syndrome, any sort of neurological symptoms that travel into the arm or the leg. Those are called radiculopathies or radicular pain, where it's got that kind of lightning bolt, tingling, numbness, So there's been a lot of research now looking at reducing stress and threat on the nervous system, helping it calm down like you're talking about, and using these mobilizations to improve blood flow to the nerves, but also help them mechanically sort of slide better. And I think you hear this talked about in the development of scoliosis, where maybe the root is some sort of neural tension, and in response to that, the body will usually try to protect itself by guarding. Maybe that's muscle spasm, muscle tightness, and maybe some of these idiopathic cases really at their roots are some sort of neural tension, and then the body's response is to tighten the various spinal muscles. You might have an ipsilateral kind of tightening just on one side, and that creates some of these different curvatures we see in the spine. And, by no means am I an expert in scoliosis, but I do think that we do see, like you said, a lot of idiopathic cases where we aren't sure what the cause is. But I think this neural tension kind of idea is a really interesting one, to look at.
I had a pretty traumatic near drowning accident in a river. I was playing around and wake surfing, body surfing with a rope, and it kind of slip knotted around my ankle, and I was trapped in the current while the current was kind of pushing me downstream, and I couldn't release my ankle from the rope. And in that down current, I think my leg and my groin was really stretched and injured, and it was over the next few years when my scoliosis formed. And now after that event, I didn't feel it in my spine. I felt it in my hip, in my groin. And I think that tightness of, not really rehabilitating, I think, that injury well. I just always thought, I'm not flexible in the hips. But I think it was during those years that I essentially clenched that groin, pelvis, and limited the natural elongation of the vertebrae through that tensed nervous system. So I think this is it really deserves like further exploration. I guess it comes down to each person to kind of explore this in their own ways. So what What do you, are there maybe some tips or some introductory kind of things you could mention around, what is it, how do you calm the nervous system? How would you check for this? Let's say, like, if you were going to be like, okay, well, let's see if we can get you into a deep state of calm in your nervous system and allow that elongation and alignment to happen. How would you approach that?
Yeah, that's a great question. I think a lot of it would be anybody who has increased nervous system threat, whether it's just some sort of pain state, it could be like a chronic pain state, or maybe it's something like this where potentially there could have been an injury to their nervous system, or maybe a situation like you're describing where maybe we don't see a direct injury to the nervous system, but there was an injury and there's been some compensation, and that as a secondary sort of consequence affects their nervous system. I think in any of those states, I often been talking to patients a lot about trying to kind of calm the waters and calm their nervous system down. And I think, some of that initially could be looking at strategies just to boost parasympathetic nervous system activity. That parasympathetic nervous system is that kind of that branch of your nervous system is more active. It's kind of the rest and digest side of your nervous system, right? Versus your sympathetic, which is everyone talks about as your fight or flight. It's the adrenaline kind of side, or something scares you, you've been startled, that kind of side of your nervous system. When you're looking at the parasympathetic side, a lot of it for people is looking at there's a number of different factors, but I think it could be implementing strategies like we hear about with like kind of mindfulness and meditation, where you just take time to be still, kind of listen to your body, really be present. So many of us are willing to dedicate time to our physical body and exercise, but not a lot of people are really good about doing that for their mind and their mental health and their stress and kind of that parasympathetic state. You think about the world, there's so many things that get our sympathetic system going. You turn the news on for any second, you go on social media, right? There's sympathetic drivers everywhere. So you really have to be disciplined and diligent, I think, about implementing parasympathetic kind of strategies. And so I tend to be a pretty ramped up, kind of anxious person. And so for me, if I get a little stressed, I really see a lot of benefit in time periods where I'll get an app and or YouTube, like there's a lot of YouTube videos just on kind of mindfulness where you can just put your headphones in. I'll lay on the bed and close my eyes and just sort of let thoughts pass through my head and just wind myself down a little bit. And I think being out in nature, I'm fortunate where I'm at to be able to go out and hike and get into nature. Things like that are great for just movement and exercise, right? Can help in these ways. Getting enough sleep. I think there's a lot of things that can help with that parasympathetic side of things. And then in terms of actual physical therapy interventions, it can be, I think if I were looking at someone and I were wondering, is there some sort of maybe neural tension here, their nervous system's been affected, we look at different what are called nerve tension tests in physical therapy. And if I had someone with a situation or a background like you had, and maybe they had like a hip injury or a pelvic injury, and they came in and clearly they're having pain, and maybe they're holding themselves in sort of an interesting way. Maybe you do see some postural compensations. Besides looking at mobility of their joints and flexibility of their muscles in their hip and pelvic region and their low back, I'd also want to test nerve mobility, like looking at the femoral nerve and the sciatic nerve. And because it's interesting, sometimes people even who don't have nerve symptoms, if you test them, you will find real asymmetries and it will trigger things in their body. And so I've found a lot of value over the years in these they're called neurodynamic tests, these neurodynamic tensioning tests, looking at them and does it recreate any symptoms in the person, or does it cause, does their body respond in an interesting way to where maybe their nervous system is a contributing factor, just the mobility of their nervous system is a contributing factor.
What do these look like?
So go ahead.
Go on.
Yeah, so the nerve tension tests, they have different ones that have been studied in cadavers. And basically what they do in cadaver studies is they'll put pins in our major peripheral nerves. So you could have like your sciatic nerve down the back, from your low back down the back of your leg, your femoral nerve that goes from your low back down the front of your leg. In your arms, you have your ulnar nerve, which everyone knows about because of hitting your funny bone. You have your median nerve, which goes through the carpal tunnel, and your radial nerve. And basically what they'll do is they'll take these, they'll put pins in the nerves in cadavers, and then they've moved the arms and legs of the cadavers and have found that by tracking the pins that our nerves have to slide anywhere from a few millimeters to a few centimeters with normal movements that we'd go throughout the day. And so those studies in cadavers then turned into studies on actual humans and ultrasound studies, different imaging studies where we can take we basically created these nerve tests and then these nerve mobilizations where you're moving the joints of the body in a very specific way to either put the nerve on tension or to put it on slack. And what they found is that those can help reduce pain. And some of that may be because it's helping the nerve slide, but other studies have shown that it actually can help improve blood flow and nutrient delivery to the nerve.
So just like, we can protract and retract and go into extension and flexion, we're saying we can go into tension and slacken our nervous system?
Totally. Yeah. It sounds like voodoo. I always tell people.
And this is something we can practice and develop.
Totally. Yes. Yep. And a lot of times the positions look like the sciatic nerve one, for instance, it looks sort of like a hamstring stretch. Like if you were laying on your back and you pulled your leg up with your knee straight to do like a hamstring stretch. It looks like that, but then what we do, so when you do a hamstring stretch, you naturally put your sciatic nerve on tension as well. So the sciatic nerve is on tension, and actually a lot of muscle stretching nowadays, when people get more flexible with muscle stretching, there's some thought that maybe the main driver in that is that we're desensitizing our nervous system. Within your muscles, you have these little muscle spindle receptors, which are basically muscle fibers wrapped with nerves, and they detect length changes. So when you put a muscle on stretch, those stretch receptors turn on and they tell your brain, ooh, danger, like might be dangerous, you might hurt something here. But when you stretch over time, you can sort of desensitize those stretch receptors. And, in high school I could do the splits. I can't now. But at that time I stretched all the time, and I got to a point where I could sort of, probably through a combination of making those muscles longer, you can actually make your muscle fibers longer, but also desensitizing the nervous system. And, that is... So anyways, going back to that hamstring stretch one, when you put yourself in that position, you also put your sciatic nerve on tension. And then what you can do is when you are targeting the nerve, you have these movements where you alternate between moving your neck and moving your ankle. And because the nervous system is continuous all the way from the foot to the spinal cord up to the brainstem, those oscillations in movement can actually cause the sciatic nerve to slide and in a lot of cases reduce pain.
So by desensitizing these, this kind of stretch receptors, I guess, so instead of stretching, I've also been kind of leaning towards more activating the muscle through the range of motion is better than stretching, right?
Yeah, I think it kind of depends on the person. I see some people where static stretching, kind of holding stretches really do work for them, but you have lots of other people where activation, and you hear a lot of this now talked about with like eccentric contractions where like you might have somebody who has tight hamstrings where, it's like I stretch all the time, it doesn't get better, but then they go do deadlifts and they get way more flexible. And eccentric contractions are contractions where the muscle's contracting but lengthening, and those have been shown to actually make muscle fibers longer. Your muscle fibers, the kind of smallest unit of a muscle is called the sarcomere, and those are all kind of in a line like cars in a train. And when you stretch or do eccentric strengthening, you actually add more cars to that train, so your muscle fiber gets longer.
So I think you're on a really interesting point there where you were saying with the sciatica nerve, essentially, you're checking your kind of range of motion between tense and slack in various nerves. Can we do this ourselves? Do we need someone to walk us through this? Is this out there? Is this possible? Because I think that's really interesting to explore.
Totally. It's out there. I actually post on these quite a bit. I usually am posting in terms of the exercises, but I have done a few where it's the tests. You can definitely do them on yourself. I mean, sometimes it's nice to have a practitioner like really control each joint, but they're pretty easy to do on yourself. You can kind of learn the position, and you're just putting your arm in like like if you're doing nerve ones, it's like your shoulder, elbow, and wrist are in a certain position, and they change for each nerve. sciatic nerve and femoral nerve, you can watch a video on them and test yourself and kind of see, oh, does it seem like there's some restriction here? You know, because there's a lot of people who have this idea that when they have a limitation in mobility or flexibility, most people tend to think it's only because of like their muscle or their joint. A lot of people aren't aware that it could be that it's nerve tension.
And so what are we looking for? We're looking for, restrictions to tense and slack, essentially, in those positions. Is that what we're looking for? And maybe suggest a few names, like what are people going to search for to really go through this nerve audit?
Yeah, so what you would do, you could find these pretty easily searching on, there are different groups that kind of talk about these, but you would look for, the big nerves are going to be, you would search for radial nerve, median nerve, ulnar nerve, those are the three in the arms, and then in the legs you would have primarily sciatic nerve and femoral nerve, and what you would do is just look for, what I would search is put the name of the nerve, so sciatic nerve, what would probably be the best keyword would be sciatic nerve tension test or sciatic nerve mobility test, something like that. Those types of keywords will tend to bring up these tests. Like I said before, the technical name is neurodynamic testing. So you could also, if you really want to be specific, you would say sciatic nerve neurodynamic testing. And that will bring up different videos. A lot of times there are videos that are put out there for clinicians, but you can create the position on your own and sort of look at, okay, if I do this position, does it recreate my familiar symptoms, whether it's pain or numbness, tingling, something like that? Or does it just seem like I have a major restriction when I put my nerve on tension, and maybe all this time I've thought it was my muscle, I was inflexible in my muscles, maybe it's really my nervous system that's holding me, and targeting the nervous system with specific nervous system mobility exercises is the way to go.
Amazing. And this is exactly why I love these conversations, and I appreciate you sharing your wisdom here, because I'm definitely exploring that route. The alignment that I feel, I've been free of back pain, and I've corrected my posture substantially. I'm all terrain at this point for many years, but at this point I'm just curious how far this can go. And as I'm delving into this, combining the relaxation of the nervous system with these particular movements, so I guess this will help me kind of be a bit more aware of where the nervous system is kind of a key player in that part of the body, and kind of work with that. Obviously, unlocking the hips and the psoas is quite a common one in my case, and in other cases. How would you approach, a pelvis, hips that are locked up, where you might have some postural imbalance further up? Where do you begin in that approach?
Yeah, it's such a common area for people to have those kind of restrictions and feel locked up, right? Like the pelvis and the hip, it's probably the primary area in the whole body. And because it's adjacent to the low back, the lumbar spine, they feed together so much. I mean, you think about psoas, right? It attaches on every level of your low back, L1, 2, 3, 4, 5, and then it attaches down to your femur. It's a really interesting muscle. It's a mover and a stabilizer. So psoas is such an interesting muscle, and like you said, you do see a lot of people where they really seem to, I think when they have back pain or they've had some sort of hip or pelvic trauma, they tend to really tighten up and lock up in their psoas. And I think my theory is that at its root, it's the nervous system feeling threatened, and the nervous system in response wants to stabilize the spine and pelvis and prevent you from moving. It wants to protect you. So tightening psoas is one of the ways to do that, because it's such an important deep stabilizer. So I do see a lot of people where, different strategies and techniques that target psoas can be really helpful. And I think the question there always to me is the person getting better because I made psoas more flexible, or is it because those techniques calmed the nervous system down in that region? Psoas is innervated by L1, 2, and 3, so it has these nerve roots that come from our low back. So sometimes, I think when you stretch psoas or mobilize it with a ball, or a practitioner does that to you, I think sometimes it could be that it's the nervous system that stretch or pressure is actually challenging and helping those nerve roots, L1, 2, 3, helping them calm down. And then in response, when they calm down, the psoas relaxes. And so I think that's a big one. Psoas is a big one when you look at tightness in people with hip and pelvic and low back issues. We'll see a lot of tenderness and trigger points out in sort of the posterolateral hip region, kind of the back pocket region, sort of in kind of the gluteus medius, gluteus minimus region, some of the deep hip rotators like piriformis, and you have all these, you kind of have a rotator cuff for your hip joint that's down deep in there. It's called the P-go-go-Q, but you have all these muscles. Piriformis is just one of them. And your sciatic nerve travels down in there with those muscles. So again, if you had something like a sciatic nerve issue, the muscles around that and adjacent to it often spasm to kind of protect the area. So it's this interesting area where a lot of times if we can release some of the glute and deep rotator muscles, the person's pain will get better, but then we will also usually kind of activate and strengthen them. And this always seems counterintuitive to people, but there's more and more research showing that in a lot of cases, if you actually put load on a muscle and kind of strengthen it, its electrical activity will actually be reduced afterwards. So the person will feel relaxed after they do a strengthening exercise.
Yeah, to know relaxation, we have to know the tension, I guess.
Yep.
I'm definitely with you with, especially with the psoas, because it is so deep, to go at it, to release it, to bring that kind of more natural movement and range of motion in it. It's very difficult to do just physically, and as it stems from the spine and the nervous system, an approach to releasing the psoas has to include the calming of that nervous system.
For sure.
One of the, I've studied various kind of myofascial kind of techniques around that area. One that's obviously really getting close to the command center of the nervous system is that suboccipital. How did you work in that area? How do you approach have you explored that area in terms of relaxing? Because you were saying your approach or your direction is conditioning the body to be more resilient to stress. So I guess walk us through that.
Yeah, and I would say that part of it is kind of a later phase thing for me. Conditioning the body to be more resilient to stress starts with calming the nervous system down. It's kind of I look at it as a three-phase kind of approach when people come to see me. So a lot of times in the beginning, calming the nervous system and calming those waters is some of those parasympathetic strategies we were talking about before: breathing, meditation, mindfulness, things like that. Also, a lot of manual therapy. Like my residency was in manual therapy. I spent a year after physical therapy school working just with my hands on people. So massage, joint mobilizations, nerve mobilizations with my hands. So that is a big piece of calming the waters, calming the nervous system in those early phases of rehabilitation. Because if you just start giving people aggressive mobility and strengthening exercises too early, it just tends to flare them up. So, and then their nervous system will protect more, and they may compensate more. It may change their posture more. So something like a suboccipital kind of technique, that's another great example. The suboccipital muscles are these 4 small muscles at the base of the skull. Your upper cervical nerve roots run through that region, and that area is often tied to headaches and things, cervicogenic headaches. I just did a video on this on YouTube yesterday. So a lot of times massage techniques on those suboccipital muscles, and even just kind of gentle mobility exercises, will give people a lot of times kind of chin tucks, where they work on kind of lengthening and extending, or flexing their upper cervical spine. So when they do that, it not only lengthens the suboccipital muscles, but it also puts a little bit of kind of mobilization on those suboccipital nerves. So I will start with strategies like that. When I'm thinking about making the person more resilient over time, the beginning of that starts with calming the nervous system down, reducing pain. And then as that pain starts to dissipate and they're looking better, and usually their posture will be improving, their movement will be improving, then we shift towards mobility and motor control. We talked a little bit about, you were talking before about coordinated, slow, kind of controlled movement. And a lot of that in the rehab world we call motor control, sort of neuromuscular control. Like how well does your brain and nervous system communicate with your muscles? How well can you coordinate the muscles in a given region to control the alignment of your body? That's sort of like dynamic posture, right? Like, which is so important. Dynamic posture is huge. And so then you're looking at mobility, motor control. And then the last phase is more focused on resistance training, or what people would think of as strength training. We have a lot of research for strength training. When you put load on things, our body does have a very mechanical component to it. And so when you use weights, external resistance, even body weight to strengthen, it makes your tissues more resilient. So your tendons get thicker, your muscles get hypertrophy, right? Your ligaments, your bone density improves. Even the discs in your spine become tougher. So we have studies on weightlifters looking at the discs in their spine and how they become tougher and thicker compared to the average person. So that's kind of the phases that I look at in terms of moving the person towards becoming more resilient.
I like that. Starting slow. Slow is smooth and smooth is fast.
Yep.
It's been a learning process to remove the ego, to really go back to the very basics and do movements that I just assume that I can do it because I did it as a baby, as a kid. But if you haven't done those things in a while, you can definitely lose those movements and they get a little wobbly, and that's where you start. Because I've made that mistake before of going to do just doing the bar squats because I could, without realizing that I had to unlock and relax all of this other stuff before even getting putting any weight on that spine.
Yeah, there's a lot to be said. I think just to kind of go on that, people maybe have heard of the concept of progressive overload with weightlifting, where you slowly put more weight. You slowly are using more weight as you go through that program, and that makes you stronger. Progressive overload also applies to mobility, like new movements and things. So exactly like what you're saying, if you haven't practiced a movement in a long time, your body will adapt to how you use it. So if you don't do full range deep squats every day, well, you're going to become tighter and stiffer with that. It's going to be more difficult to do that. And you can implement progressive overload just like you would with trying to get stronger in the weight room. You could also do that with mobility. So don't expect that the first day, you're going to get all the way down to that full squat again if you haven't done it in years. Well, you've got to slowly build up and ramp up your range of motion. So that's a form of progressive overload. It's just instead of adding weight, you're increasing range of motion over time. So like I said, I could do the splits in high school. I can't do the splits now, but I don't practice stretching the splits anymore. And if I wanted to get the splits back, I wouldn't just think that I'm just going to drop on the floor right now and go into full center splits. I'd probably injure my groin muscles, my adductors. So stretching also requires a sort of progressive overload. You have to be consistent with things. You constantly put small increasing levels of stress on the tissues, and they adapt over time. That's what's so cool about the musculoskeletal system, is that it has this amazing ability to adapt to appropriately dose stress.
And it's such a long journey, especially for people who are rehabilitating with various issues, deficiencies. Obviously the postural deficiencies. It's a very long journey, and they may if the structure has been seriously compromised, they may never even reach that ideal, perfect, normal looking posture in their lives. So it's a very taxing journey mentally for a lot of people. How do you approach that when you're dealing with patients that have an incredibly long healing journey ahead of them, and they may not have been active, or that it might not be a priority in their life to be moving and taking care of their body like this? How do you approach that mentally, I guess?
Yeah, it's a tough one, right? I mean, I really try to spend a lot of time on education. I think the education is really important, and a lot of times in traditional medical and rehab settings, with how insurance is structured and how fast practitioners have to see people, there's not time for education. And I think a lot of times people are given things to do, but they don't really understand why, how long is this going to take, is it going to get all the way better? And so I really try to spend a lot of time with people setting realistic expectations and kind of explaining, because patience is a huge part of any kind of most rehabilitation situations. There's just the musculoskeletal system, while it has an amazing ability to heal, it can take a long time. I mean, a lot of these conditions take many, many months, up to years to change. And if you're talking about something that the person's been dealing with for years, has been around for a long time, you have to set that expectation that this is going to take consistent work, and it's going to take many months probably to make a significant change in. And even at that, setting the expectation that we don't always know how much this is going to change. Will it go all the way to sort of full range of motion or full function? That might not be possible. I mean, sometimes that's the case. I had someone recently who fractured her wrist. She fell on her bike and fractured her wrist. And, we spent 8 months, just her coming in here and literally me jiu-jitsuing, putting her in submission holds and stretching her wrist joint because of the scar tissue and the range of motion that was lost there. And there are some situations, smaller joints like that, it's not always realistic that the person's going to gain their full range of motion back. You can do everything possible, stretch hours a day, and they can make really significant gains. But sometimes, you get to a point where her surgeon was telling her this, and then I work with her for 8 months, and it's like, this is probably, you hit 80% of normal range of motion. This may be as far as this is going to go. There's no harm in continuing to work on it. If it were my body, I would want to continue working on it and see how far I can take it. But it's a lot of work, and you have to realize that sometimes rehabilitation exercises and interventions feel like homework to people, and they get fatigued with doing this stuff. And so there is I think a lot of it boils down to education and trying to set expectations as best you can, while realizing that there's a huge degree of uncertainty in this, and everybody's body is different and how they heal is different. So you kind of try to look at the patterns you've seen in the years of working with different people, and you use that to kind of inform what you tell them. But you still have to realize there is some uncertainty, and it's a little bit of an experiment with each person. Their nervous system is unique, their body's unique, and you move forward, and you try to, and a lot of it is trying to help people stay positive. I think almost a lot of what I do these days is I act as sort of like a rehabilitation coach or a pain coach, and I'm reassuring people, like helping them stay positive, because most people feel down when they're injured, or they can't function the way they want, or they have something that's affecting how they move and limiting the things that they like to do.
It does require a lot of hope. Personally, I think eventually the process gets rewarding when you get to know your body. The journey itself provides a lot of rewards when you learn how your body moves, and you learn what your body's capable of, and you kind of witness this healing process. I think that process really adds a lot of other benefits into life, and so I thank you for the education that you're doing. Who would benefit from the education that you're putting out there, and where would they find that?
Yeah, well, I feel like our education system doesn't do enough to teach people about their movement system. But this is kinesiology, right? This is a study of human movement. We don't learn this in school. People take basic health classes, but there's not a lot about the musculoskeletal system, the movement system, and we have this one system that we're going to take through the rest of our lives, and there's so much you can do to take care of it and keep it healthy and limit the odds that you have major injuries or have to have major operations later in life. Like today I was talking about knee osteoarthritis and total knee replacement. So genetics are always there's often a genetic component with a lot of these things, but there's also so much you can do in terms of behavior and lifestyle, and a lot of that comes down to having a movement and exercise program and taking care of things like your stress and sleep and your nutrition. And if people want to learn more about these things, I would say it would be, of course, the people who have pain or have injury. But I am also spending so much time trying to educate people on the fact that a lot of the things I teach also just help keep your movement system healthy. And so, you know, rehabilitation exercises that people get in physical therapy, often they stop them as soon as they kind of feel better. And that we really, you know, there would probably be some exercises you would get rid of, but when it comes to like mobility and strength exercises, so many of those are good to keep in as a regular practice just to continue to keep that system resilient and durable, and to reduce the odds that you get something again in the future or have an injury. And if people, you know, I'm at Rehab Science on Instagram and YouTube. Those are my two kind of primary platforms. I post every day different movements and exercises for various conditions. Usually it's focused on something. Like this week, just the last couple of days, I've been doing knee arthritis. But again, those exercises, we have research showing that when you do them, it also reduces the chances that you get that problem. So they're not just pain and rehab and injury, also just keeping that movement system healthy. So those two platforms. And then I had the people who are watching video, there's this red book behind me. That is my new book. It's called Rehab Science: How to Overcome Pain and Heal from Injury. It's on Barnes & Noble and Amazon. It's 500 pages. It has almost 500 research citations, but it was written for the everyday person who doesn't have a background in this information. So it has chapters on pain and injury and kind of that science so that everybody can understand that. And then a little over half of the book are exercise programs for the 50 most common conditions organized by body region. So you could go to the shoulder chapter or the ankle chapter or the knee chapter and find some condition. Like say I've got a meniscus injury. I could go to the knee chapter, and right there is a 3-phased program with pictures of me doing the exercises, instructions for the exercises. It's basically like you went to a physical therapist and they gave you a program for the 50 most common conditions that's got pictures and instructions, because the truth of the matter is so many movement system musculoskeletal conditions get better with education, time, and the right movement/exercise program. All those things you can do on your own if you just have the right information.
You clearly know your stuff, so thank you for sharing it and coming on here. I would like to wrap up with just something for social media. I think that's the majority of people, unfortunately, are educating in the shorter form. So in a minute, let's say someone's coming. Let's take back pain. If someone's, I guess you're starting off the video, and we've got 1 minute here. So if you have low back pain, this is what you do. How would you answer that?
Yeah, so I'd say if you have low back pain, the most important things to do is to think about kind of going through different phases. And so in the beginning, you want to start addressing factors that may be making your symptoms worse, kind of flaring your symptoms up. So thinking about how can I just calm pain down? That could be kind of simple mobility exercises. It could be manual therapy interventions like a practitioner would use, massage, joint mobilizations, nerve mobilizations like we were talking about, looking at your sleep quality, your nutrition, your stress. So all these things that help just calm the system down, calm the nervous system down initially. And then as the symptoms dissipate, moving towards mobility exercises and motor control exercises. Mobility exercises often help people with low back pain. So looking at the different directions the spine moves and practicing those on a daily basis. And then the last step is resistance training exercises.
Do you have an example of a few of those?
Yeah, so things like cobra exercises, like we're going through extension, child's pose where you take the spine through flexion. You'd have rotational stretches and then side bending stretches. But those often really help people in conjunction with those hip stretches, psoas stretches, glute stretches, hip-based stretches often really help people with back pain. And then I would say the last piece is making that region more resilient. As the pain is going away, looking at strengthening exercises that make the spine more durable, help protect you from injury in the future. So things like planks, dead bugs, bird dogs. It could just be things as you get better, deadlifts, even just squatting. All of those things activate and strengthen your trunk muscles, and those are extremely important for reducing the risk of having back pain again in the future.
Awesome. Thank you very much. Your experience is clearly showing, so thanks for coming on.
Yeah, thanks, Sam. I appreciate it, man. Thanks for the opportunity.